Stop.
Well, good afternoon, and thank you for joining us for a daily update today. I'm Dougal Saunders, joined again by the Chief Executive of the Western New South Wales Local Health District, Scott McLaughlin, and Assistant Commissioner Jeff McKechnie, Commander for the Western Region for New South Wales Police. Sadly, as you may have heard, today I can report that this region has its first death, a patient who was positive for COVID-19. Scott will provide more details around that shortly, but of course our thoughts, our sympathies, our condolences with family and friends. Up until 8 o'clock last night, 51 new cases of COVID-19 across the Western region. Dubbo Regional Council has 33 new cases. Bathurst Local Government Area 5, Burke LGA 4, Orange LGA has 2 also for Parkes LGA and 2 for Forbes LGA. Narromine Local Government Area has 1, Brewarrina Local Government Area has 1, and Blaney Local Government Area has 1. For the far west, Wilcannia has 7 new cases and Broken Hill 2. So for the Western New South Wales Health District, total number of cases is now 561. Dubbo has 434 of those. Out of that 51 new cases across the region today, 14 are known to be infectious in the community. That includes in the Bathurst LGA, the Blaney LGA, the Brewarrina LGA and the Dubbo local government area as well. And Scott will provide some more details about those linkages and the household contacts, etc. Yesterday, only 3,650 tests roughly were done across the region. Again, a really low number considering where we're heading with numbers at the other end of the scale. We are encouraging, again, every single person who has the mildest of symptoms, or if you have any concerns can relate to interactions with a venue of concern or a person in your life that has been to one of those venues of concern. Please, we are encouraging you once again today to come forward for testing as soon as possible if you have any concerns or the mildest of symptoms. We've got a regular update happening on the New South Wales Health website. We've got a link to exactly where to look on this post right now. We're encouraging you to check it as many times a day as you can, to be perfectly honest. Things are updated very rapidly. We need you to be keeping in touch with that and also keeping other members of your friend circle, your family in touch with exactly what's happening and doing the right thing. Testing clinics are of course open all over the place. We want you to be vigilant and make sure you're telling your friends and family the same thing. Now on vaccinations, of course, a pretty exciting day recently for the opening of the Dubbo drive-through clinic, the first of its kind in New South Wales. It's fantastic, open 7 days a week for bookings only. There's a special way of booking. We've got a link to that on this Facebook post right now as well. So bookings, they're doing anywhere between 100 and 200 a day, which is fantastic. And a very special chance today, only until 3:30. We're calling it a Mad Monday opportunity. It is for AstraZeneca only. If you go there, you can get in without an appointment today for AstraZeneca only. Today only, and only until 3:30 this afternoon. Now, the entry for that is on Wingewarra Street, right near Chelmsford Street. You're turning into the showground from that entrance. There are people there, there are staff there in high vis and a fair bit of signage. So if you've got an appointment, happy days, go to your appointment. If you don't, but you're happy to line up and drive through with AstraZeneca today, this is the time, through until 3:30 this afternoon, just for today only. Otherwise, do a booking and make sure you're part of that. Bookings for the other main clinic, which is now at the Woolpack Pavilion. It's actually right next door to the drive-through. Again, same entrance off Wingewarra Street. But those bookings, there are more and more appointments available for both Pfizer and AstraZeneca through that main eligibility booking system. Now, from today, that will include 16 to 39-year-olds as they become eligible through the federal government scheme. So you can continue to book for that all the time. You can also call on 1800 571 155 for your bookings, and we're encouraging everyone to get involved in that. We've obviously had the amazing pop-up clinic that's been functioning at Dubbo at Pioneer Park to wrap up the weekend, and at Dubbo Regional Theatre due to some inclement weather last week. Just under 5,000 people across that whole period came forward for their vaccinations, which is fantastic. A really nice hit for the entire region. It's not doing everyone. It was part of the plan was to make sure we got a bulk number done as quickly as possible. That's now happened. That crew has moved on. They'll be in places like Mudgee and Golgong and across to Dunedoo and Coolah. They'll be back in a couple of weeks for second doses. There's been a lot of questions about that. You won't need to book. It'll be the same as the first dose. If you've had a first dose, we will be letting you know as we get closer to the time the exact details. But roughly in 2 weeks' time, that crew will be back doing second doses for everyone who's had a first dose already. So keep in touch. We'll certainly let you know when it's coming up. In the meantime, there are plenty of ways to continue getting vaccinated, including that number I just mentioned or through the eligibility checker. Check with your GPs as well. Plenty of GPs have capability. Aboriginal Medical Services have capability as well. We have also the ability to do it through pharmacies. So please make sure you're doing the very best you can to ensure that you're getting your booking, looking after yourself and your family as much as possible. ADF and health teams are right now heading out across the region. In fact, most of those are underway today. So Forbes, last day today, starting at Galar and Grawin today as well, they're underway. Mudgee and Golgong underway. I've had a couple of pickies in from Golgong where people are lining up at the Memorial Hall there. Fantastic stuff. Nyngan underway as well at the Showground Pavilion. So lots of those clinics are underway. Again, there is a link to the New South Wales Health website on this post to find out more details about exactly what's happening at your area, but there is something coming up this week and more details on the post. Just remember to take your Medicare card if you have one. If you don't and you have an individual health identification number, take that. If you don't have anything, make sure you at least have some identification with you. And on Wellington, 10 till 4 again, the booking clinic open for the special Vax clinic at Wellington, which is involving WAX, the Swiss Street Medical Centre and Health. There's been over 828 vaccinations that have already happened through that clinic last week. That is continuing again today. 6845 5423 is the number to actually book on. It has been extremely busy. I know it's hard, you just need to keep trying. Apart from the actual clinic that's being run, WAX is doing its own vaccinating as well, as is Swift Street Medical. 300 according to Swift Street Medical over the past week, including a couple of hundred AZ on Saturday. So everyone in that community is doing the right thing. Congratulations, it's been a huge success. I've mentioned before, but Transport for New South Wales is providing help if you need to get to a Vax clinic or know somebody who needs the help. Again, a link on this website, this Facebook post I should say, to how to get involved, and tell your friends and family if somebody needs help. We're really trying to make sure we do help them. And remember to cancel bookings if you are doing something else. You've been to a walk-in clinic or you're heading to one today at Mudgee or Golgong, for example, and you've got a booking. Make sure you cancel the other booking so it frees up for somebody else. Now, again, there's a lot of information here. We do ask you to look through, check higher up in the post. There's lots of comments that come through which may be an answer to your solution. There's lots of links that we post there to provide as much information for you to find. Get that right link to keep going as quickly as you possibly can. And look, vaccination rates are increasing all the time, which is fantastic news. As of Friday, Dubbo first dose 64.5%, and Narromine 68.8%, Gilgandra over 69%. Lots of work still being done. We want to see those levels keep rising, so keep reaching out, keep getting tested, and keep reaching out and getting your vaccinations as well. Obviously today, we've got to talk more about the health implications. We need you also to think about the fact that people are under the weather. They're feeling sick, some very sick. So keep that in mind when you're dealing with people and thinking about how you can help along the way. I'll hand over to Scott now for his update.
Thanks, Dougal. Well, a very sad and sombre day today with the passing of a 50-year-old Aboriginal man in Dubbo Health Service. Sincere sympathies and thoughts go out to the family, the friends and the broader Aboriginal community across Dubbo and the whole of the region. Now, there couldn't be a more timely day to be focusing on vaccination. This gentleman was not vaccinated. We know that people will die if the vaccines don't get into arms We know there's a lot of misinformation out there. There's a lot of opportunity for people to get vaccinated across Western New South Wales. Can I please implore everyone, this is time for us to all step up, get the jab, get double jabbed. Don't mess around any longer. That there's vaccination opportunities available across the GPs, Aboriginal Medical Services, our vaccination hubs, our drive-through clinic today, having a Mad Monday with the ability just for today to drive up and get AstraZeneca jab. I'll talk more about that. It's a very sad day, I know, for Dubbo and the whole of the region. So in the last 24 hours, we've seen 51 new cases, again a record number in Western New South Wales. There's still far too much community spread and people infectious in the community. In the numbers to 8 p.m. last night, Dubbo saw 33 new cases, Bathurst 5, Burke 4, Forbes and Parks and Orange 2, Blaney, Brewarrina and Narromine 1 case each in those communities. Now we've got 20 cases out of those 51 that have been linked, 13 with household contacts and 70 known to a known cluster. 31 are still under investigation. In the last 24 hours as well, we've seen 14 out of the 51 cases were definitely infectious in our communities across Western New South Wales. So this is time for us to be really vigilant. Know that any signs and symptoms, however mild, please come and get tested urgently. Don't mess around for 24, 48 hours, just come immediately. Out of our total cases, we've now seen growth in the number of people over the age of 70 that have contracted COVID. We've now got 13 people aged over 70. We've still got, though, a large proportion under the age of 50, 85% under 50 and 40% under 20, with still around 65% of our cases being of Aboriginal descent. In the last 24 hours, there's a significant update again to the venues of concern. Can I implore everyone, please keep an eye on the list of venues of concern, either from the regular social media posts, the New South Wales Health and New South Wales Gov websites. The majority are in Dubbo, with 63 in Dubbo, 15 each in Bathurst and Orange, 9 in Wellington, 6 in Parks, 5 in Narromine, 4 each in Gilgandra and Burke, and 2 in Galarganbone. Please, those are the places where someone has been infectious, where we haven't been able to get in contact with everyone that's been at those venues, so that could be you, and so please take that seriously. We haven't seen any new sewage detections come through in the last 24 hours. A lot of those sewage tests are being taken today. Now, worryingly, we saw again a further drop, the lowest in the last couple of weeks, with only 2,900 tests done across the whole of the local health district. Some concerning low levels in locations where we know there have been infectious cases in those communities. So Dubbo 1,758, Mudgee 122, Bathurst 822, Orange 378. Between Parks and Forbes, around 60 tests across the two communities, and Wellington 48 and Burke 105, with a lot of other tests going on across some of our smaller rural health services as well. Please, this is time to come and get tested. If you've got any signs and symptoms, however mild, or any concerns, you may have been in a location, you might have been in contact with someone, you may have some symptoms coming on. Please come and get tested immediately. It's our best solution, our best surveillance at the moment for keeping in front of this. All of our drive-through testing and our health services will remain open right throughout the rest of the week. We are standing up some additional testing locations. We'll announce those in the next 24 hours, where we've had new cases identified, and in particular Blaney. So please keep your eye out for those. A lot of our drive-through testing and walk-up facilities are very quick at the moment. The testing turnaround times are again continuing to come down. We've also set up some mobile in-home testing now across Dubbo, Orange and Bathurst. The contact point for that, if you're vulnerable, if you can't leave your home and really do need someone to come and test you, is our public health number, 1300 066 055. Otherwise, please reach out to your local health service or the drive-through services for testing. We've now got 16 patients in hospital, 4 in intensive care, of which 3 are ventilated at the moment. Across those 16 patients, 12 are in Dubbo and 4 in Orange. We've now seen 31 patients discharged in the last 24 hours from our Care in the Community program, so that's seen a decrease in the numbers in that program. That's our specialist teams going into home to provide support to both COVID positive patients and people with other health conditions. So we've now got a total of 433 people being cared for in that service. We've seen a significant reduction again in the numbers of healthcare workers in isolation. We've got now currently 63 workers, so that's helped us to return a lot of staff back into the workplace that have been in isolation for some time, either awaiting tests or the full 14 days if they were close contacts. We've seen some new health workers come into both Dubbo and Bathurst. 9 staff in total, 6 to Bathurst and 3 to Orange. A lot of those are nurses with intensive care skills and other support. We're going to see more and more staff coming in to give us a hand in coming days and weeks. And including, thankfully, and very helpfully, 20 Rural Fire Service volunteers that are landing today, a lot of them with health expertise and the ability to help care and provide support to our community. And vaccination, as I said, we've got an opportunity today at the Dubbo drive-through clinic for people that want AstraZeneca to come and drive up. It's just for today, and we do have appointments and the capacity to see people. And so, if you come into the back entrance into the showground, you'll be able to access that drive-in clinic. Last week we saw a record number of people getting vaccinated across the region, over 11,000 people right across the whole of the local health district. That's up fivefold from what we'd be typically vaccinating in previous weeks, around 2,000 people a week previously. That's the benefit of having the ADF here, but also being able to scale up with a lot more vaccine coming into the region. Again, we've seen an increase in the vaccination rates across Western New South Wales, with now 55% of people with first dose and 26% with second dose, and a significant jump in the number of Aboriginal people being vaccinated in the last week. I'll go through some more of those figures later on. The opportunities for 12 to 15-year-old teenagers and kids will come in the next couple of weeks with our vaccination hubs and clinics able to open up from the 13th of September. We know that there's some GPs and other Aboriginal medical services already able to vaccinate 12 to 15-year-olds, but the opportunity opens up today for people over the age of 16 through our booking centres and our vaccination hubs. Last week we saw a significant number of Pfizer doses being delivered in, both from the state and the Commonwealth. Nearly 20,000 additional doses came in last week, significant volumes from the Commonwealth into the GPs, the Aboriginal medical services, the pharmacies and the respiratory clinics. And so please look out for opportunities. Go to the Health Direct website or call Health Direct and look for opportunities to get vaccinated. With the first death in our region, it's a timely reminder that this opportunity to get vaccinated is a lifesaver. It will save you, it will save your family, it will save your friends. And the last thing we want to see is more deaths in Western New South Wales, and so please don't take this as a time to sit back on the armchair and think, I'll do it tomorrow, I'll do it the next day. Do it today. It may not be today that you can get a vaccination into your arm, but please book in. It's urgent and the time is now. Listen, I'm going to leave it there and hand over to Jeff McKechnie. Thanks, Jeff.
Thank you, Scott. Good afternoon, everyone. A tragic day, and I know a lot of people here in Dubbo today would be feeling very sad about the loss of that man overnight, and our thoughts and sincere condolences go out to his family and his friends, obviously. But what a significant reminder that is for us of the dangers that this virus is presenting to us at the moment. So please, as Scott said, take that opportunity to get yourself vaccinated while you can. Look after yourself, your family, and the rest of your community. Overnight, still across Western region, 160 infringement notices issued to people for various types of offences in contravention of the health orders. In Arana Mid-Western, Dubbo, around 30 infringements issued. So still 30 people out there, not taking the situation we currently find ourselves in seriously. It beggars belief, to be honest. but people still keep flouting those rules, putting themselves and others in danger. So please, if you've got any influence over those people, and I think we're dealing with a group now, largely in many instances in a lot of our towns across the region, who just seem intent on not following the rules. So we really do need our communities, our leaders in those communities, our influencers to help us where you can and try to talk to those people, particularly our young people, and try to reinforce with them the seriousness of this situation. I'm still getting some questions about mask wearing. Outside your home, you have to wear a mask at the moment, and really it's just such a basic protective device at the moment. To think that anyone would be outside their home doing something around other people without wearing a mask is again mind-boggling. But please wear your mask. It's a $500 ticket if you haven't got it on, and again, believe it or not, we are still handing them out. So we just need to continue our focus on compliance. We still need to continue our focus on well-being. Wilcannia is of great concern to us, Burke, all of those locations, those isolated locations. We are pouring more resources into those places. Currently, we've got additional ADF resources in Wilcannia and Burke, and here in Dubbo. Extra police in Wilcannia and Dubbo as well, out there delivering those wellbeing packages, checking in on people, making sure people are okay. But we really do need people to be compliant, stay at home, stay where you are, lock yourself down, and avoid getting COVID at present. With that, I'm happy to answer any questions anyone might have of me today.
Thank you. If anyone has any questions for Assistant Commissioner McKechnie, if you could just put your virtual hand up, please. Doesn't look like there are any questions for you today. And for everyone, I apologise for the technical problems earlier, which muted everybody except for me and stubbornly refused to stop doing that. So we might just ask if Mr. Saunders could step up, and if you could put your hands up if you have any questions for Mr. Saunders, please.
Thank you.
No questions
happy
for you
days.
either today, Mr. Saunders. And obviously, just a reminder for any of you that missed any of the content earlier on today, there is the recording that we will send out as soon as possible, as well as the Facebook feed from Mr. Saunders' page today. So we do have a few people with their hands up, but we will go through all of you one at a time. Obviously, you only have 2 questions. We only have time for 2 questions from everybody. If when I call your name, if you could take yourselves off mute and ask your questions for Mr. McLaughlin, that would be fantastic. So if it's okay, we might start with our friends at Prime. Claudia, do you have a couple of questions?
Sorry, can you guys hear me there?
Yeah, sure,
Yeah, we can, Claudia.
Hi, how are you all? I do have a couple of questions. Scott, would you be able to talk to us about the situation at Bathurst Prison? Understood there's 8 active cases in the staff now. Are you concerned the community is at risk because obviously these staff need to leave and go back to their families and homes?
Well, clearly, across the whole of Western New South Wales, there's people that have been infectious in our communities right across the whole of the region. We know that the issues that the Bathurst Correction Centre are facing does have a number of corrections officers that have become infected and have been infectious in the community. So I think it's a timely warning and reminder for all of us that on any day of the week, any hour of the day, it could be yourself, it could be the person next to you at the service station in the supermarket. And so please don't be complacent for a second. We know that people that work at the Bathurst Correction Centre or Bathurst Jail didn't pick up this infection knowingly. They haven't spread it knowingly. I just urge a bit of caution and understanding for the situation that's happening, but no one should be complacent for a second.
Thank you so much. And do we know whether they contracted it from inmates inside the prison or whether they've contracted brought it into the prison?
I don't think we've tracked down exactly the point of transmission yet. I know that work will still be underway with our contact tracing teams, working with both Corrections Health and Corrections themselves. And so that work will continue, I think, regardless of the source. We know that there's a risk right across the whole of our region for every person, every day of the week, that the next person could be you.
Thank you so much.
Thanks, Claudia. Hamish, do you have any questions as well from Prime?
I do. Thank you, Scott. We heard in the 11 o'clock press from the Premier that the man in his 50s who tragically passed away had some underlying health issues. Is that correct? And are you able to give more details on that?
Sure. So, at a very sad day for Western New South Wales, the passing of a gentleman in his 50s, an Aboriginal man, did have some underlying health issues. And we know that he was in intensive care, being supported by our specialist teams. His unfortunate passing had some underlying health issues, but nonetheless, it's a reminder he wasn't vaccinated. Whether he had COVID, it's a reminder for all of us that vaccination is our solution to stop people dying. It stops people getting into intensive care. It stops people getting really crook. We've still got a significant number of our population aged over 70 that aren't vaccinated. So only 75% of our people aged over 70 in Western New South Wales are vaccinated. So can I urge everyone, the time is now. Don't mess around. Don't wait for tomorrow or the next day to book in for a vaccination. Please do it today.
Anything else from you, Hamish?
Yes, Scott, are you able just to elaborate on the Indigenous figure, the Indigenous community and the stats behind the vaccination rate with them?
Sure, Hamish. So I'll just get this out for you. So we've seen a significant jump in the last couple of weeks in the number of Aboriginal people across Western New South Wales that are coming forward to get vaccinated, and that's a pleasing step up, albeit coming from a much lower rate than the non-Aboriginal population. So across a couple of local government areas that have seen a significant increase, Coonamble has now seen 48% of Aboriginal people with first dose and 20% with second dose. Brewarrina, 58% with first dose and 18% with second dose. Burke, 42% with first dose and 6% with second dose. Dubbo Regional Council area, 31% with first dose and 9% with second dose. Warren, 51% with first dose and 12% with second dose. Now, but those are pleasing increases. We know that we've still got a long way to go to get to those magical numbers of 80% of the whole population vaccinated that are eligible. Now, that means for Aboriginal people right across the whole of the region, everyone older than the age of 12. So please can I urge the community, with the death and passing of a loved one in the last 24 hours, please reach out for vaccination opportunities through your Aboriginal Medical Service, for your GP, the local vaccination hubs. The drive-through clinic here in Dubbo today is free, accessible, and for one day only you'll be able to get drive up to that vaccination hub. So please don't delay. Don't delay another day. Today, please take some steps to get vaccinated.
Thanks, Hamish. We might go to Xanthi.
Hi, Kathy. It's Molly Gorman here from ABC. I'm jumping in for Xanthi. She just had to, we were a late substitution.
Sorry, Molly, I didn't know that. Sorry.
It's okay. It's a common mistake. I wanted to ask, in regards to people being transferred from the Dubbo Hospital to the Tamworth Hospital for treatment, do you have any information about that, and what patients are being transferred? Are they COVID patients or otherwise?
I'm not sure whether we've transferred any patients over to Tamworth Hospital, but we do have a network right across the whole of the state of our intensive care beds, and a network that on a regular basis we see patients move between Dubbo, Orange, Bathurst, our network into Sydney, and we know that John Hunter Hospital, for example, plays a critical role in the network in the whole northern part of the state. And so our intensive care capacity is being increased every day of the week. We've got more beds, more ventilators, more staff that are coming online to help us care for patients that might need critical care in our hospitals in Dubbo, Orange and Bathurst. If that needs be, we might reach out to Tamworth and to John Hunter, just knowing that the whole of the state's network is really well connected and organised.
Thank you. And secondly, why aren't numbers going down? You know, you flagged last week that we'd expect numbers to remain in that sort of 25 to 35 bracket. Instead, they continue to rise and are showing up in places which didn't necessarily have cases before. Is there any way you can explain that?
Sure. So what we did see today was 50% of the new cases have all been in isolation, and so that's not a surprise. We know that they've been in isolation with someone that's infectious with COVID in the house, and so that's a good thing that we're seeing cases identified that have been in isolation. The ones that we really worry about were the ones that were infectious in the community, and so 13 were infectious for more than 48 hours, and one patient was infectious for up to 48 hours, with 12 still under investigation. And so there's still reason for us to be really concerned and cautious that we've still got too many people being identified that have been infectious in the community. So can I please urge everyone, come and get tested if you've got any signs and symptoms. If it comes on in an hour or 6 hours, just the slightest sniffle, little fever, little scratchy throat, your stomach's a bit upset, if you've got any concerns that you might have been in a location of concern or in touch with someone that might have had COVID, then please come forward and get tested. Our numbers are way too low. We've got to get them up. We've got to get people tested earlier and stop this spread of the 13 people in the last 48 hours or more that have been infectious in our community.
Thanks, Molly. We might go to Tom Barber at the Daily Liberal.
Yep. Hi, Scott. You mentioned there was 16 people in hospital in the region. How many of those are vaccinated? Are you aware?
Tom, I haven't got data on those full 16 at the moment. We do know that the gentleman that sadly passed overnight was not vaccinated. So that, for me, is the ultimate reminder that vaccination is the solution to stopping people getting really crook. It's time now. Don't mess around for another day to get vaccinated.
Yep. And the low testing numbers are increasing. I guess that's getting a lot more concerning. Is there any indication why those numbers, the testing numbers, keep getting lower and lower?
Look, Tom, I think there's a real apathy across the region. People just becoming tired of the stay-at-home orders, the impact on all of our lives, and I do understand that. It's tough at the moment and it's scary for a lot of people. But the only way we're going to stop this is people continuing to get tested, helping us know where COVID is spreading and helping us get in front of it. And so please don't mess around for another day and getting tested. The decreasing numbers, I think, are a real concern that we're all feeling tired and concerned and stressed about the situation we're in. I just ask for everyone to hang in there. Please don't mess around for another hour or another day if you've got any symptoms.
Thanks, Tom. We might go to Joe Woodburn at the ABC.
Thank you. Mr McLaughlin, given that, just talking about testing numbers just there and how low they are, but yet we've had a record high number of COVID cases, could that mean, or does that mean that there's actually potentially a lot more cases circulating in the community, but we just don't know about them because the testing rates are so low?
Well, I think we do need to be ready for the COVID case numbers to continue to grow. We know that just the people in isolation within households that will still become infected in coming days and weeks, we'll see numbers grow across the region, and just the pure number of people that have been infectious in the community means this will continue to grow in Western New South Wales. We've seen the cases stretch over 500 across the whole of the region, over 400 in Dubbo, and today's record high number of 51 cases. Don't mess around for a second. Now's the time to come and get tested, please. While we are seeing these increasing numbers of cases, we know that there's more people out in the community that are infectious, and so please don't delay for a second.
And my second question is with regards to what the state government announced at the weekend about getting schools back. Will there be any special dispensation for teachers in the Western region to allow them to get their vaccinations through, say, the ADF clinics? Will priority be given to teachers, or a special day for vaccinations like the state government's intending?
Well, we know that there's a lot of opportunity for vaccination across the region, across the GPs, the pharmacies, the Aboriginal medical services, the respiratory clinics, our vaccination hubs, the pop-up clinics from the ADF, and so there's no shortage of vaccination opportunities. There's no question that teachers are an absolute priority, like a lot of other groups in our community, that we all want to see schools resume. We all want to see teachers and kids be safe and stop the spread of COVID in Western New South Wales. We'll definitely be looking at how we can provide teachers some fast-track opportunities to vaccination. But please, for all the teachers in the region, don't delay. Today is the time to book in for a vaccination. The sooner you can get in, the sooner we can all be more protected and safe across the region.
Sorry, do you mind if I just clarify that? It's because of the deadline for getting schools back. So say if they got an AstraZeneca today or this week, they wouldn't be fully vaccinated by the time schools are due to go back. So would Pfizer be more available to teachers to be able to get them within that sort of 3 weeks, 4 weeks immunisation period?
Well, AstraZeneca is a very safe and effective vaccine. It's very readily available. There's now a much shorter window for the second jab, so we can now get a second jab in this region within 4 weeks. So the equivalent, in essence, of the Pfizer vaccination timeframes. So please, I would urge everyone to look for opportunities for vaccination today. Don't mess around any longer. The time frame for getting your second jab for AstraZeneca is now 4 weeks. Pfizer, likewise, is a short turnaround time. And so for all of the teachers in the region, today's the day. Please look for opportunities to be vaccinated.
Thank you.
Thanks, Joe. Bradley Jerd at the Western Advocate.
Hey, Scott. I just wanted to ask about, I think it was mentioned before by Prime, there's quite a lot of number of cases up at the jail. I just want to ask, is New South Wales Health or Western Health providing any kind of support to the staff up there?
Sure. Listen, we've been working really closely with Corrections Health and the Justice Health Corrections team to make sure that all of the new infected cases, the corrections staff, are being well supported in the community. They're all in isolation. There'll be a support team that'll go in to help them with their clinical condition and any other supports that they might need throughout this time. I think it's time for us to be aware that in any of our communities there can be someone walking around any of our towns infectious. We know that was the case with some of the corrections health staff in Bathurst and surrounding communities. And so can I please urge everyone, be on the lookout for any signs and symptoms you might have. Come and get tested really quickly.
And the Kelso testing clinic, I think it's been open almost for about a week now. What have the numbers been like there? Has it been well received, or would you still, of course, probably want to see more testing numbers there?
So I believe we've paused the Kelso testing clinic just recently. That's been converted into a mobile testing team that will be able to go into homes to help people that have transport issues, aren't able to get out of their house for mobility reasons or other vulnerable community issues. And so that there's some teams that will come into the home to help test you for COVID-19. If you call the number 1300 066 055, that's certainly the case in Dubbo, Orange and Bathurst at the moment.
All right, thank you.
Thanks, Maggie at the Parks Phoenix.
Thank you. I'm just wondering, how long does it take to identify a venue of concern? Last week, after another case was identified, I think on Wednesday, no new venues of concern were listed in parks, and there was a lot of questions in the community about that. Or was that case connected to some of the previous cases?
So Maggie, when we've identified a new case of COVID, that the team go through a rapid assessment to understand when they became infectious, where they might have been, and to very quickly contact those locations if we can. In some cases that's difficult. And help ascertain, are we able to contact everyone that might have been at the location if there was someone infectious there, and if there's a risk to public concern. Now, if we can't contact every one of those locations, that's when we'll list a venue as a venue of concern. Now, quite often that can take as little as 12, 24 hours. Some of those are coming out very rapidly. Some of them are taking, because of those case interviews being complex and needing to chase up, up to 48, 72 hours. Now, I know that's a long time to wait, but we don't go out and notify people unless we can't contact everyone that's been at those venues. So you may not see those pop up in all instances, but please, everyone, keep an eye on that statewide list of the new venues of concern. We've got growing numbers every day of the week. If you have been at any of those venues, follow the advice. Come and get tested immediately. You'll be provided with some advice to either get tested and isolate until your results are back, or test and isolate right for a full 14-day period.
Thanks. And then my second question, the 2 new cases in Parks and 2 in Forbes today. Do you have any more information on that, and are they perhaps linked?
We're still undergoing the investigations with the new cases in both Parks and Forbes. We know that one of the cases in Forbes was a close contact and in isolation for the whole of their infectious period. The other 3 cases across the 2 communities are still under investigation, so we'll be able to provide more information. But we need to assume that there's people that are infectious with COVID in all of our communities. Parks, Forbes, Condobolin, Dubbo, Bathurst, Burke, right across the whole of the region. Please don't think that just because the town down the road has had someone infectious that it isn't your community, that it's not the house next to you, it's not the person behind you in the line at Woolies. So please, everyone, take all of the precautions. Wear your mask, sanitise your hands, socially distance, check into facilities with QR codes, and importantly, come and get tested if you've got any signs and symptoms come on, if you've got any concerns that you might have been in a location or in contact with someone.
Thanks very much.
Thanks, Maggie. Renee from the Forbes Advocate.
Thank you. I think the only thing further I'd have to that, do you have the vaccination numbers from the Forbes walk-in clinic for the weekend? Or so far, that's still going today?
Yeah, it still is going today. I believe yesterday was something like 560 people were vaccinated through that clinic. So it was really pleasing to see the community coming out. And I know right across the region with the ADF pop-up clinics, there's a lot of people lining up and wanting to get vaccinated. So can I say thank you to everyone who's taken the opportunity with those clinics, and particularly in Forbes over the weekend and today.
And just we did also see a few shout-outs on social media to a mobile team that also goes out in partnership. Is that right? Does that also happen? There's a mobile team that goes out, or just door to door? Sorry. Yeah.
So we've got a number of mobile teams across the whole of the region. Loxley Health, some of our own vaccination teams. So there are people that are going out sometimes door to door with the ADF if we've got capacity, and we know that there's parts of the community that we particularly want to get vaccinated. So yes, we are starting to do that, but can I encourage everyone, look for a vaccination opportunity today. Don't mess around any longer. There's appointments available. Today, even in Dubbo, the drive-through clinic has the ability for you to come up without an appointment just for today, so please don't stall any longer.
Thank you.
Thank you. Riley from the CWD.
Yeah, hey. So just on the low testing numbers, a little bit again. We're seeing a lot of talk on social media and stuff like that, and even people coming to us, sort of saying because they've got one vaccination shot that they don't need to get tested. I guess can you just speak to that, kind of talk to those people, I guess?
Sure. So even if you've had 1 or 2 vaccinations, that doesn't protect you from picking up COVID from someone else. It also doesn't protect you from becoming infectious. Now, at a much lower rate, people do become infectious, but can I please urge everyone, now's the time to come and get tested if you've been vaccinated, if you've had a previous test. Even if you don't have any really heavy symptoms, something's just starting to niggle at you, please come forward and get tested urgently.
Okay, thanks for that. The other question, obviously we had 2 cases here in Orange again. I guess, do you have any sort of more information where they might pick that up from? Were they active in the community? Just that kind of stuff, really?
Sure. We know that both of the new cases that have been identified in Orange have been in isolation for the whole of their infectious period. And so happy with that for 1 day in Orange, but we know that there's been infectious people in the community in Orange in the last week. And so please, for the whole of Orange and community, don't hesitate. Come and get tested.
Cheers for that.
Thanks, Riley. Lee at
Hi, Scott. I'm interested in the Brewarrina case. So that makes 2 cases in Brewarrina now. I'm just wondering whether they were infectious in the community, and also what sort of testing and vaccination opportunities are out there at the moment.
Sure. So yes, the Brewarrina case that's been identified to APM last night makes the second case in Brewarrina. This new case was infectious in the community. Can I ask everyone in Brewarrina and surrounding communities, come forward and get tested. Our local multi-purpose service, health service, has the ability to test. Please phone ahead and please come and get tested if you've got any signs and symptoms, however mild, any concerns you might have been in a location or connected to someone with COVID.
Sorry, and the vaccination opportunities out there, what have they got available?
Sure. So we know that the Oka Health Clinic, the Aboriginal Medical Service, both have vaccination opportunities available for people. Either go to the vaccination eligibility checker on the Health Direct website or call directly to those clinics to get vaccinated. What we are really worried about though is we've seen in the last week with the ADF pop-up clinics very low numbers. I think Saturday we only saw 29 people come to get vaccinated, and with a huge team ready to vaccinate the community. And so this is a real stark warning for the community of Brewarrina. Please don't mess around with COVID. It'll spread around the community if we don't get in front of it. It will spread very quickly if we're not vaccinated, and it will spread very quickly if you don't come forward and get tested as early as possible.
Thanks.
Thanks, Lee. Cameron from SMH.
Hi, thank you, Scott. Look, you mentioned some of the figures earlier, but can you elaborate if there's been much of a change in the figures you gave last week in terms of, for the whole health district, the full vaccination rates for the general population and the Aboriginal population? I believe last week it was about 6.3% compared to 26%. Has that changed much?
Yes, it has, Cameron. It's gone up by a couple of percentage points for all of those groups. So for first and second dose, in the whole of the population, we do have a growing number and rate of people getting vaccinated. So 55% across the whole of the district have had a first dose, 26% a second dose, now 6.3% of the Aboriginal community have had a second dose. Now that's still a much lower figure than what we would want to see. It has increased. It's nearly doubled in the past 3 weeks, and so there's some pleasing signs there. Those rates of a couple of our local government areas that have seen nearly 40 and 50% of Aboriginal people having a first dose is really pleasing. It means over the next 2, 3, 4 weeks, we've still got a significant challenge in front of us to get the 30,000 Aboriginal people across Western New South Wales fully vaccinated, and that's our absolute determination to do that. And so can I please implore all community, all the mob, to come forward and get a jab in the next couple of weeks. Please don't delay.
Sorry, and to clarify, how many Aboriginal people have received their first jab, and how much has that changed in the past few weeks? Because obviously I understand getting fully vaccinated takes a bit longer, but how has that changed? Unless I misheard you, I thought you just mentioned the general community for first jabs. Yeah,
that's right, mate. I don't have the figures with me for first dose for Aboriginal community, but I can tell you across a couple of localities, we've got Burke at 42%, Brewarrina at 58%, Canamble at 48%, Dubbo, the Regional Council area, at 31%, Gilgandra at 34%, Narromine at 24%, Walgett at 40%, and Warren at 51%. So across a couple of those localities, there's rapidly increasing rates of Aboriginal people having their first dose.
Thank you.
Thanks, Cameron. And finally, Andrew at Magic Budgie.
Hi, thanks, guys. Scott, must be great to see the communities of Mudgee and Golgong coming out today at the pop-up clinics, and the Mudgee one reaching capacity within the first hour of its operation.
Oh, Basso, it's been a flood. We're really impressed that so many people across Mudgee, Golgong and surrounding communities have come to get vaccinated. We know that not everyone will be able to be vaccinated today. The team are in town throughout the week, and so everyone just have some patience. I know it's it's a good thing to get vaccinated. I really think it is the most urgent thing we can do. And so please don't be discouraged. Come back again. And we know that the lines were long this morning. We hate to turn anyone away, but we do really appreciate everyone wanting to get vaccinated as quickly as possible.
Can I ask, what is the capacity of the pop-up clinics in the area? And also, I don't know, it must be a little bit bittersweet having such high turnouts for vaccinations, but yet such a low number for testing, because the one kind of goes in hand with the other, doesn't it?
Yeah, it sure does. So can I encourage everyone, if you've just been vaccinated, don't hesitate, come and get tested if you've got any signs and symptoms, however mild. At some of these clinics, the testing locations are co-located and side by side, so please everyone, don't mess around with COVID. If you've got any signs and symptoms, however mild, any concerns you might have been in connection with someone that's had a sniffle or a cough or a bit of a fever, a bit of an upset belly, or if you might have been in a location, come forward and get tested. So to everyone in Mudgee, please don't delay. We know that there's been people in the community that have been infectious in the community in the last week. It's a time for real concern, some determination. We've got to stop COVID around our communities. So please, let's get the testing rates back up again as quickly as we can.
Yeah, cool. Thanks.
No worries. I think that wraps it up for today. I think everyone's had a turn. Thank you very much, and apologies again for the problems that we had at the start of the feed. You will get the recording a little bit later on today, which will include everything. So you certainly haven't missed anything. Thank you, Scott, and thank you, everybody.
Thanks, everyone.